relationship issues?
Relationship Talk
On 702.
And today we are doing our quarterly sexual health Q&A segment with the renowned experts that I always invite to studio to field your sexual health related questions. So we've got Professor Shingai, Mutambirwa, and Dr. Mpume Zenda, who will be addressing all your sexual health related questions and concerns, from sexual performance and pleasure, whether it's fertility related challenges, sexually transmitted diseases, any question related to your sexual health. Get them ready. You can call us on 011-883-0702. The WhatsApp line is 072-702-1702. And look, sexual health, as I always say, is fundamental to the overall health and well-being of you as an individual and of you as a couple. So give us a call if you have any sexual challenges you want addressed, or you want to know if something is normal, or you have that burning question that you've always wanted answered, or maybe you just want to improve your sex life. I mean, in the past, people have called in to know whether it's normal to, for instance, pass gas during an orgasm. They wanted to know about vaginal discharge, low semen volume. How can I increase my sperm volume? You know, do sores mean happies? Whatever question you have. And just a reminder, this is adult radio, so no kids are allowed. So your questions on 011-883-0702. WhatsApp's on 072-702-1702. Professor Shingai and Dr. Mpume Zenda, welcome to the show. Good morning.
Good morning, Clement.
Morning.
You know we're not happy you're not here.
I know. I see your face. I see your face already. I'm like, I'm in trouble here.
She's not happy. I'm fine. You look better on video.
Well, I miss you guys. I wish I was there in the studio with you. I do. I promise I do. So we're going to be going straight to the questions. In fact, some are already coming through on the WhatsApp line. And there are some that actually, because every time we do the Q&A, there are so many questions that come through. We don't even get a chance to get through all of them. So what we sometimes do is we take some of the questions that we didn't complete, we didn't get a chance to get to in the previous segment, and we just roll them over to this segment. So I'll start there with a few, and then we'll go to some WhatsApps. We'll take some calls as well. So the first question that I'll start with from the last session says, hi, Clement. Whenever I reach an orgasm, I experience pain in my abdomen. Should I be concerned?
This is a man or a woman? It should be a man, I assume. Or is it a woman?
Yeah, they didn't indicate here.
Okay.
Maybe should we answer both? Women and men?
Answer for women, then I'll answer
Yeah.
for men.
Yeah.
It is, yes, during the orgasm, you get some kind of pelvic floor contraction. It is very uncommon, or they shouldn't be experiencing pain. And if they are, it definitely needs a little bit more further investigation in terms of, is there anything underlying? Sometimes if there's a cyst, fibroids unlikely to cause any kind of pain, especially after, not during. So I would definitely say if it's something that is persisting and especially, we always say if it bothers the person, please do go see a healthcare provider so that we can exclude any underlying gynecological issues.
Dr. Shingai?
Yeah, I think again, we being medical, we want to give the medical names for these things. When you have pain during orgasm, we call it dyspareunia. It sounds very cool. It's dyspareunia. But anyways,
it doesn't sound painful at all. It's like, ooh, dyspareunia.
No, dyspareunia is very painful.
Very painful. But now for a guy, when we've talked many times about the prostate, which is sitting just below the bladder all the way around the pipe for passing urine, which is also the pipe for ejaculation. And it produces most of what a guy ejaculates, including a gland called the seminal vesicle, because less than 1% of what we ejaculate as guys is sperm. And when we get orgasm, there's muscles which are going to be squeezing all around this prostate, trying to push out all the semen out into the great white yonder out there. And when that happens, there can be pain for a number of different reasons. As Mpume was saying, we also have a muscle very similar to females called the pelvic diaphragm. It's a big muscle that sits at the bottom below the prostate. It's holding up all the pelvic organs and holding up all your mohodus and things inside there. And that can you can get pain in that because of some of the glands there. But you can also more commonly get inflammation of the prostate, which we call prostatitis, which can then cause you to get this pain as well. It's very unlikely it's going to be cancer. It can happen, but it's very unlikely. But that's the most common things. And like Mpume's saying, if you do have it regularly, you should probably be getting yourself checked out. Make sure there's no infection. Usually it's not a STI. It's usually a bladder. It's sort of like an inverted comma bladder infection. But the point is that it sometimes needs therapy.
Okay. And then here's another question. Hi, Clement. Anonymous here from Joburg. Please, can you ask the doctor, at first when I was having sex, I had an orgasm. Since I started to masturbate, my penis is numb. It gets hard, but I don't feel anything when I'm penetrating. But when I masturbate, I orgasm and I release sperm. Is there anything wrong with me?
It's only wrong if you don't feel comfortable about it. Obviously, he's not comfortable about it, so therefore there is something wrong. I think the short answer for him is that the biggest sex organ is the brain. We know that orgasm is based on a number of different things. Basically, it's the sensation of the penis, it's the tactility, how well you can feel and touch down there. But it then generally, when we're looking at sexual dysfunctions, there's three of them. For which the first one is the pain. Not the most common by any stretch of the imagination. There's the desire, the way you think about it, and the arousal, the erection itself. And he seems to be having no problems with arousal or with pain. So the desire part, the one in the brain, which is based on a lot of different things, including the so-called man chemical testosterone, but also just the way you psychologically think about it. And if he's talking about because he's been masturbating a lot, there's lots of issues might come out. There might be guilt. There might be problems that he's been stimulating himself. There's lots of things that are going on. But if it's bothering him, go and see a sexual health specialist who can then make the better diagnosis.
Okay. Dr. Zenda, one person here says, hi, Clement, Anonymous here. My wife has been having a problem with a discharge that has a bad scent. It has been going on for almost 2 years now. What can we do?
First and foremost, come see me or
There you
go see. Here's the thing. A discharge or some kind of vaginal lubrication is very normal. About 15 mils of that is very normal. But because of the ecosystem of the vagina that has a very sensitive pH balance, sometimes what happens when that goes off, you can get a bad scent, particularly from something called a bacterial infection called bacterial vaginosis that can give a bit of an off smell. Now, it also has a lot to do that pH can be, it could be something that she's using on a regular, for example, harsh soaps. It could be a start or stopping a type of contraceptive that could contribute to that. So we just need to find out what is the instigating factor. Sometimes even sexual intimacy can cause that just because the pH between semen and, the vagina is so different. But the fact that it's just been for the last 2 years, so it's something she didn't always have. It's something that has come up. We would need to investigate to see what is the instigator that is changing that pH. It doesn't necessarily mean that there is an STI, although that is one of the screening things that we will probably do as part of the investigation to make sure that there is nothing underlying. Although, for the most part, the vagina or sexually transmitted infections that cause that discharge and a foul smell, often we can treat very easily with antibiotics. And the problem is if it's left unchecked, it can have more grave consequences like what we call PID, also or the destruction of the tubes, which then can lead to infertility. So it's important that, it might be something very minor or something that actually can cause grave consequences. So she needs to definitely get seen by a gynae.
Yeah. And then on Twitter, someone says, and yeah, I'm sure you always expect this question, Dr. Shingai. Someone says, hi, Clement, please can you ask Dr. Shingai, since I started masturbating a lot, my penis has been shrinking and shrinking and shrinking. Is there a link between masturbating a lot and your penis shrinking?
The short answer is no. When we get an erection as guys, basically we've got two sponge-like tissues called the corpora sitting underneath the skin. They make the most of the size of the penis. And when you get an erection, blood just rushes in there. And it's an amazing amount of blood, actually, because it's the most engorged organ that you can get. Even if you exercise, you can only increase the amount of blood going to your heart by about 5 times. But when you get an erection or clitoral engorgement, because they're exactly the same organs, you get up to 120 times increased blood flow. So it's massive. The more you get blood in there, it also helps with the oxygenation. That's why babies and from birth baby boys are getting erections, because they need oxygen in there. They're getting between 12 and 15 erections, much better per day. That is much better than most adults, I would say, as a general. And so the more you use it, the more likely it's going to actually increase in size, actually get bigger. So I can basically almost put my finger on the fact that it's, again, a psychological aspect. One of them is going to be the fact that you might be feeling a guilt about this. And masturbation is good for your health, guys. It's good. It's fine. Just get on with it. Females, same thing, please.
No matter how many times you do it?
It doesn't really make any difference. You must, if you haven't got a job, I guess you can do it all day. But if you've got a job, I think you might find it a little bit difficult. But there's no real limit to the amount. So I think he must also do that. But also the other aspect, which I think is so important, is that we look a lot of internet and stuff like that when we're doing it. I mean, everyone looks at videos and such. The average porn video takes up to 3 days to make. And that's for that 10, 15 minutes or whatever. And if you're observing, you'll actually see that the background changes and such, but usually you're most concentrated on one aspect. But the point is that they also Photoshop, obviously. Of course, They wouldn't Photoshop. They Photoshop. So you start thinking, hold on, this guy has got 2 hands over this thing, and I only have 3 fingers. Relax, okay? Your penis is fine. If you're enjoying yourself, take it easy. There's no way it's getting smaller, not from that.
Yeah. Okay, I've got some many more questions that have come through on our WhatsApp line. We'll get to them after the break. It's 20 minutes after 11 o'clock. This is our relationship and sex feature. And what we're doing today is what I promised you we would do every quarter. So our quarterly sexual health Q&A segment with Professor Shingai and Dr. Mpume Zenda. So if you've got any sexual health related question, you can give us a call on 011-883-0702. The WhatsApp line is 072-702-1702. That's all we're doing this hour, taking your questions. We'll be back after this break.
Relationship issues?
Relationship talk.
On 702.
24 minutes after 11 o'clock, straight back to your questions on 011-883-0702. Let's start with your WhatsApps on 072-702-1702.
Good morning, Clement, and good morning to the guests there. Clement, I have one question. I've just noticed my 11-year-old daughter, her urine is starting to smell like unpleasantly so I just wanted to find out what may be the cause of that. And another thing, I did ask the mother about it, so the mother told me that she noticed that she started having some discharges. Can the good doctor there help me out on that one? I just need clarity, like I'm a bit concerned.
Yeah, so on the urine part, that just has a lot to do with diet, with also the amount of water you'll find, especially if they're very active. They need to maybe up their water intake. But also what they tend to get at this stage, remember at 11 years old, they're just figuring out the whole hygiene thing for themselves. So they may be very much prone to urinary tract infections, and that can very easily also add to that smell. So it's just a matter of you as parents going through that whole thing of how best to take care of, hygiene. I'm not sure if she has started her period or not. You can include that as part of it. But the other thing is just encouraging, good habits in the home, drinking water, that kind of stuff, lessening on, processed drinks like fizzy drinks and lots of sugar and things like that. That helps a lot. She also will be likely to get yeast infections as well, especially if the diet is not very well managed. So it's nothing out of the ordinary. It's very common, and this is the time where you also want to do it very sensitively and not as something that is punitive, as something like she's doing anything bad. And I always say, very often our children do what they see us do. So watch out what's happening in the household in terms of how we're taking care of our lifestyle.
I think the way forward, to be practical, is that I think you should get seen by the pediatrician just to get a general check. They should get a urine test done, make sure there's no bladder infections. And I know it's a big issue, but it's a big issue in South Africa. We do know that that sexual abuse can happen. It's not the commonest reason for this by any stretch of the imagination, but a discussion with the young lady just to find out that there's nothing major going on is also important. But I think just take the pediatrician, at least get a urine test.
Okay, here's another voice note.
Good day. Thanks for a wonderful show. I just want to find out, does exercise really, increase the sensitivity of the penis, which at the end of the day leads to early ejaculation? Or are there any other factors that lead to that other than physical exercise? Thanks.
Okay. Yeah.
Thank you very much for that. Yeah,
Thanks,
Dr. Gynae.
very much. The physical exercise, short answer, it's the best thing you can ever do. Okay, it improves every aspect of your life. I must say, just as a side thing, because I know in females they're going to talk about wetting themselves, and the more you exercise as a female and more intense, the more likely you're going to wet yourself. But it's still improving your heart. It's helping you, doing all lots of stuff. So it's good for your heart, good for everything, and including premature ejaculation. There's no good evidence that exercise or not exercising doesn't causes you a premature ejaculation. But we know the main cause for premature ejaculation, which is by far the commonest sexual dysfunction that men get. 80% of us get it at some stage in our lives. It's because of a chemical in the brain called serotonin, which is a bit low, and that's more likely. So please don't stop exercising. Exercising is just good in general.
Here's another one.
If I may just add to that, is it possible, though, with the slight increase of the testosterone during exercise, if he's not getting it as often at home, that what he then perceives as premature ejaculation is just a matter of short supply?
Great. He's just brought in some
Short supply.
Short supply. Yeah.
Hey, I'm just like, girls, let's be more active.
Masturbating more frequently. First, Mpume, you're so good. You bring back the physiology. The only way to raise your testosterone naturally is by exercising, okay? And but testosterone is not directly related to premature ejaculation. And so I would say, again, it's a no. It's a no.
Yeah.
It's a no, but I think it is important for us to bring in the fact that the more you do ejaculate, the less likely it is one of the options for patients with premature ejaculation to help to decrease it. And sex is a form of exercise. So the more you exercise, the more you sexercise, the more you exercise. So keep it up.
The more you sexercise, the more you exercise. All right, here's another voice note.
Hi, good day, Clement. Please put a question to your guest. My wife had a depot shot about 2 weeks ago, and since then she hasn't been as lubricated as she used to. But this is not the first time I'm using it. It hasn't happened before, but now all of a sudden. Do you think this is one of the symptoms or effect of the depot? What do you think it could be?
Yeah.
Oh, thank you.
So definitely the Depot is an injectable, the 3-month injectable, and it is a 3-monthly injectable contraceptive. And definitely it's a progestin only. It definitely can cause a little bit of that vaginal dryness. Over and above, I think, we don't know how old she is because your wife is, he's mentioning that she has used it before. You might find that concomitant to getting a little bit older, the older we get as women, 35 years and above, of course, worse off in our 40s, is that with the decline of the estrogen, particularly the estrogen, you do get a lot more vaginal dryness. It could be somebody maybe who's just had a baby, and that has a big effect on that estrogen hormone, and as a result, it will also cause dryness. So it could be something that is Yes, in itself, Depo can cause a vaginal dryness, but over and above that, you have to look at what's also going on in the woman's life and at which phase is she in. Just using, water-based lube goes a very long way, and there is nothing wrong with using more lube, especially because if you're trying not to fall pregnant, you also can't be like, okay, let's get rid of the contraceptive. So just using extra lube, as long as especially none of the other aspects of the sexual experience are not overly affected. Things like, desire, arousal, and the ability to orgasm. I think we'll still be fine just on using lube. If it's something that is really bothering her, I know he mentioned only 2 weeks. If after 3 months you feel like this is not the right fit for you, you're not married to the contraceptive, you're married to your husband. So see your gynae and see if you can change into something that works a little bit more suitable for you.
Yeah, like you and Elna McIntosh, our mentor, and you with lubricate, just lubricate, guys, please, just lubricate.
It should be part of groceries, actually.
Yeah.
It's 11:31. Let's get the latest in Eyewitness News headlines. We'll continue taking more of your questions, and my guests, Professor Shingai and Dr. Mpume, will continue responding to them. So keep them coming. You can call, you can send us a WhatsApp voice note.
Relationship issues
Relationship Talk
on 702.
24 minutes before 12 o'clock, we are taking your calls on 011-883-0702, WhatsApps on 072-702-1702. This is our quarterly sexual health segment with our experts in the field of sexual health, Professor Shingai Mutambirwa and Dr. Mpume Zenda, and they're addressing all your sexual health related questions and concerns. I want us to go straight to your questions on the WhatsApp line on 072-702-1702.
Hi there, Clement and doctors. I just wanted to ask, my girlfriend used to take these prevention pills, and ever since she stopped, we've been trying to conceive. It's been almost a year now, and we haven't got anything. So any advice on that? Because even when she goes on her periods, there's no blood that comes out, but just brown stuff. So I just want some information and clarity on that. Thank you.
All right. So it is very much imperative that a woman ovulates for them to be able to fall pregnant. That's the first basis of, pregnancy. But also when you're thinking about, and I'm not necessarily saying that you guys are experiencing infertility, it might just be difficult conception because of a number of things. Contraception in itself does not interfere necessarily with your fertility profile or how fertile you are. The injectables may delay your getting back into your ovulatory cycle. So getting back to that ovulation, it's the one that takes the longest. I often say, think of it this way. When you've missed a pill, we always say take it as quickly as possible. If you've missed 2, then we say please use a barrier method for another 7 days. And that's because of how quickly that medication can actually get out of your system and the risk of falling pregnant. If you are less than 35 years of age, and this is for both male and female, because we know that, the infertility is not only a burden or something that has to do with the woman's reproductive system. 50% is actually as a result of the male factor. If you're 35 and have been trying for a year, and trying means that you are using some kind of an ovulatory cycle to see where she's at, because the window period is also very short. It's about 48 or a little bit more than 48 hours. That's how long the egg will last. So it's taking all those things into consideration. I would definitely say see a gynae, especially if you've been trying for a year, so that we can just figure out where we need to tweak things. Sometimes there are underlying issues like things like endometriosis, things like polycystic ovarian syndrome, things like PID that they may have had at an earlier stage. So all of these things we need to do a full assessment. So she definitely needs to see a gynae, and I think by all means and purposes, it's always a good thing for the man to check his sperm profile as well. Semen analysis.
Like you said, 50% of the time it's going to be the guy, 50% of it's the female, and there's a crossover. And I think even though might be, and I always like to say, as I said, that it could be related or unrelated. So it could be related to the contraception, but it might be unrelated completely. So I think you should get seen as the guy should be seen by a urologist or a GP. You can get a semen done, and then the female should see her gynecologist or GP, because GPs are also good at some of this.
Yeah. Anonymous says, "Hi Clement, please can you ask the doctor what are the easiest solutions to avoid early ejaculation rather than drinking pills or delay sprays?" Oh, there are delay sprays?
Yeah.
Okay. Rather than delay sprays or pills. Because sometimes you are caught up in a moment with your partner and there's no time to apply the spray or take the pill, as it requires you to do it 30 minutes to an hour before sexual intercourse.
Very interesting. Okay, first of all, premature ejaculation, I said, the commonest sexual problem that guys get. The treatments, we break them down into conservative, which means that we're changing, going for a psychological assessment, because sometimes that does help. Pinching the tip of the penis, withdrawal methods, various things like that. And then the next step is to go for some of the medications. And usually the medications that we're going to be using will be like this pea spray, which is basically what we call a local anesthetic. It stops sensation on the tip of the penis, which has some evidence, but not great. We also then use some of these medications to try to raise the chemical serotonin in the brain. The commonest ones we use in South Africa are forms of antidepressants called SSRIs, or serotonin reuptake inhibitors. They work pretty well. And if he's really worried about spontaneity, he's obviously using this pill and the sprays on demand. But the evidence actually for using the SSRIs on a daily basis is better than even for on demand. So if he's really worried about that, maybe just try to take them daily. There are some side effects, including decreased erectile function and stuff. But the point is that I think that's the way to go. Then going for in the future, we've got things like we were doing trials using Botox, which is the same stuff they use for facelifts and stuff, to paralyze nerves and things. And in the future, that might be some of the options that we'll use. But for the moment, probably maybe just try daily dosing with the SSRI that he's using.
What if you spend more time on foreplay? I think that would benefit everybody.
Thank you very much. I think that's, a good point.
Spend more time on foreplay and
see what happens from there. That's also a good thing. And also, just you remember that after the first ejaculation, because it releases a hormone that causes the blood vessels to squeeze down. It takes time for that to break down. But once it's broken down, you might find that you can get the second round lasting longer as well. So maybe play with yourself beforehand as well, as part of your foreplay, and then go and see the partner.
Okay.
Yeah.
Another one says, Clement, anonymous here. I'm a guy who's 45 years old. I have lost my sex drive. I'm not sure if it's the PrEP medication that I've been taking. Is there a link between PrEP and the loss of a sex drive?
Yeah. PrEP, which is pre-exposure prophylaxis. If I'm not mistaken, that's the one he's complaining about. That's talking about. That's when we use some medications when you know you're going to be getting involved in sexuality and you might be a bit of a risk to getting HIV. That you take this tablet before, and it's excellent stuff. It works very well. And also post-exposure, please, just as a side thing, if you do get exposed, you can still use post-exposure prophylaxis. Excellent stuff. Now, the thing is that any chemical that we put in our bodies can make a change in our sexuality and our libido. So again, it might be related to the tablet, and there is some data to show that some of the medications we use for preventing HIV, and also even for treating HIV, do have an effect on it. By the way, also HIV itself is what we call neurotropic or vascular tropic. It basically damages blood vessels. It can cause sexual dysfunction itself as HIV. But the point is that I think it could also be related to other things. For example, the decrease in in our so-called male hormone testosterone as we get older, and various other things. Even the way he's thinking about it, maybe he's getting stressed about the idea of that he's having to use this PrEP. So I think again, probably the best option, and it's always the fallback. Go and see somebody who's got an interest in sexual medicine, and then just see what's going on. But definitely the PrEP could cause it as well.
Morning, Clement and the doctors. The 10-year prescription of, is it tamoxifen ended? Will the dryness go from the vagina? That's a 55-year, this message says 55 years post breast cancer treatment.
Yeah. Not entirely, because also you've got the overlap now of the menopausal. So you got the breast cancer, you got the menopausal. It definitely will make it better. but no, if she's already 55, she's already in that menopausal phase. So the dryness unlikely to go away, but just something that I think there's a lot of medication that is out there that has been coming out that doesn't have estrogen in it, or that does not stimulate the estrogen receptors. And sometimes something also that really is helpful is looking at the testosterone levels, and particularly for postmenopausal women, that seems to do a lot of good in that area of just arousal, relieving or alleviating the dryness. Yeah. So there's a lot more, but unfortunately the overlap between the breast cancer and the menopause, even though we've stopped the tamoxifen, it might not necessarily make it that much better.
Yeah, Mpume, maybe just for the listeners, tamoxifen actually blocks estrogens, the receptor for estrogen, and estrogen is huge for female sexuality as well as for male sexuality. So, and it is necessary for quite a number of different, because there are different types of breast cancer, but it is necessary for some, and it can be dangerous to get the estrogen back later, even if you're in remission. That's why she's talking about testosterone, and we are doing some trials using testosterone rather than estrogen for patients for the same problem.
Yeah. Here's a WhatsApp voice note.
Hi, Clement and the doctors. Please help. I'm currently pregnant, and during my first trimester, I was on the Utrogestan pill that I would insert. And then second trimester, the doctor said that we can now start having sex. But now we try, but my vagina is so tight, it's so painful that my husband can't even penetrate. I wanted to find out, does the Utrogestan pill cause the vagina to become tight, and what do I need to use so that we make our sex life easier and enjoyable? Thank you.
Oh, that's a very loaded question. First of all, the reason we often would use a progesterone in the early pregnancy is if there is some risk of a miscarriage. Progestation, it causes or rather it stops the uterus from having those minor contractions, which may inevitably cause a miscarriage. So we generally use it for somebody either because they've had a previous miscarriage, or if we've done a test of the progesterone, we found it low, to prevent that miscarriage. Now, in the second trimester, ideally, also because in the first trimester, you get the morning sickness because of the HCG, which is the pregnancy hormone that increases quite significantly in the first trimester. We generally don't get that much of it. So the tightness is very, very surprising in the second trimester. You generally find women, they are more open to it. I would probably say, obviously, have this conversation with your gynae. Something that does tend to happen is they tend to have a lot more discharge, actually, and being more prone to yeast infections and urinary tract infection during pregnancy. So chat to your gynae and see if there's anything that we need to sort out, treat in that regard. But over and above that, I think it goes back to that whole psychology where couples very often find it very tricky to have intercourse, or whether it's because of just their own beliefs, maybe they're concerned about, or there is a scare or a fear that we might actually do something wrong and hurt the baby or cause a miscarriage. So it's a number of different things, but definitely this is something that she can definitely raise with her gynae and make sure that there is nothing else going on.
Just quickly, Mpume, so that, because I'm thinking some of the guys are thinking out there, oh no, are you not supposed to be having sex in the first trimester?
Please
That's not true.
Yes,
it's only for high risk patients that you're talking
absolutely.
about.
Yeah.
Okay, here's probably going to be a tough question. Morning, Clement and the doctors. I'm 60 years old. My wife and I still enjoy good sex life. What I want to find out is, how can I prolong or have a second round? Because after my wife has had an orgasm, she still wants me to carry on.
Yes,
but after I have had an orgasm, my penis is not that hard anymore. Please, can you advise? And he's 60.
He's 60. First of all, well done, because we've got data to show if a guy over the age of 60 has sex twice a week rather than twice a month, they increase their longevity by 7 years. It's good for your health.
Oh, wow.
And that's at any age, even going to 80, 90. I've got one patient who's 98. I'm hoping he's going to continue until he's...
so the secret to living longer
is
twice a month.
Yes. And decreasing
twice
prostate
a week.
Twice a
Clement.
week.
A week.
Not twice a week.
A week.
Yeah, but you can do it with yourself. You don't have to be with her. But anyways, that's another story for another day. But the short answer for him is that when we get erections, there's just a lot of blood rushing into the spongy tissues. When we have orgasm, whether we like it or not, this chemical called noradrenaline is released. It causes the blood vessels to squeeze down. So once you've had an orgasm for a guy, your penis is going to go down as a general rule until you can break down that chemical. And that's why we always, with this discussion about guys being best in 18 to 22, the only reason why they're better than older guys is because they can break down that noradrenaline faster within about 5-6 seconds. If you live to 80, it might be a month before you can break it down, okay? But the point is that that's what has to be. So it's perfectly normal what's going on here.
Yeah.
But if there are things that you want to change, you first of all just do get yourself checked, make sure you haven't got diabetes, all that sort of stuff. And then we do know there is some data for the so-called PDE5s, that's phosphodiesterase 5 inhibitors, which basically relax the blood vessels, that you might be able to shorten that period for breakdown, which we call the refractory period. And so these are the Viagras and the tadalafils, the ones of these things on the market. They do have some evidence, but it's not great evidence, but it is there. And I do think that he might work for him as well.
Okay. It's 10 minutes before 12 o'clock. We'll come back and wrap up with more of your questions.
Relationship issues
Relationship Talk.
on 702.
8 minutes before 12 o'clock, we are just about to wrap up the quarterly sexual health segment, Q&A segment with Dr. Zenda and Professor Shingai. So let's go to some of the WhatsApp messages here. Let's start here. Hi, Dr. Shingai. My circumcised penis is developing some skin, transparent. Upon cleaning thoroughly, with a face cloth, it becomes fine. Is it normal? I've tried to keep it moist, but it's been 2 months now. Should I be worried?
Well, there's so many nuances to this. When was he done the circumcision? When did this thing start? There's a lot of stuff, but I'll just go quickly. If it's been done recently, I mean, that's in the last 3 to 6 months, because it takes a long time to heal this thing, because we're getting lots of erections and nonsense. And but anyways, then it's probably nothing to be worried about, and he might just be having some other issues. But there are things like, for example, specific allergies, eczemas, and things which can cause it. Sometimes, if there's still some redundant skin, you can get some what we call desloughing. Some of the skin underneath there gets worn out and it comes out. But I think, again, just go see your GP and just have a quick look at it. But I definitely, if it's only been under 6 months, I really wouldn't get too worried about it as a general rule.
Okay. Before we go to the next WhatsApp voice note, question here says, please can you ask the doctors there what's their take on the use of cannabis to increase libido or sex drive and reduce early ejaculation? That's a question from Anonymous.
Well, the early education part is definitely
We'll deal with
you.
that.
Look,
Definitely me. Are you accusing me of?
No, I'm just saying, early ejaculation
What have you heard about me?
is your area.
It's your expertise, Dr. Shingai.
Look, when we look at there's a lot of work that is being done. I mean, I was at a conference in Cape Town, and one of the lectures was basically looking at the research around that. And I think it's the non-stoning part, if I can put it in lay terms. I think the THC, they're finding that it's really helpful, especially in women with issues with pain during intimacy. And obviously, very often you'll find that anybody who's experiencing pain during sex, they either will start avoiding it or just, not want to engage altogether. So there definitely is research that's ongoing there. But I think also just from the streets and, patient care or patient, seeing patients in the rooms, a lot of patients who have come across have actually alluded to the fact that it does help or it does stimulate. Now, where we stand at evidence-based medicine. We need to see it on trials and I think there is a bit of is it an ethical or dilemma there?
It's a bit of ethics, a bit of safety.
Ethics, safety, because we also know that cannabis in its raw form with all its components, the psychiatrist will give you all the data in that what are the repercussions or consequences later on. So there's never a point where we can be saying that it can be used. unless it comes from proper, clinical trials that have been researched. And like I said, a lot of from our side and from the gynae side, we've looked at it particularly from a pain control perspective. Cancer patients with pain syndromes or painful syndromes. We've looked at it, but as it is.
Yeah. I think the short answer, for pain, there's quite good data. There's also no data for premature ejaculation. Similarly, alcohol, which a lot of guys say will make your sex better, there's no good evidence. In fact, it should probably be detrimental. The cannabinoids on top of that do have some dangers. It's not for everybody. Just because it might help a little bit with pain and might help a little bit with the sex function for some people, there are still things that anything you put in your body can have an effect. So it's not for everybody, but if you're taking it for specifically for premature ejaculation or erectile function, there's no evidence yet.
Okay, I've got 20 seconds left here. A question here says, "Hi Clement, I'm 42 years old and I've never been penetrated by a man in my life. I have masturbated in my teen years, but then I stopped. As an adult now, I'm dating my man and he can't penetrate, and every time we try to be intimate, that becomes an issue for us." I'm not sure what the question is here, but he says she's never been penetrated before. She's 42. It seems like they're having trouble with the men now penetrating her. What could be the cause of that?
Most likely she probably has vaginismus, which is basically a combination of a psychological something going on that causes them to have an involuntary tightening of the pelvic floor muscle, and therefore it causes them not to be able to have penetration. Please, I think one important thing, go see a sexologist. We usually work in combination with physiotherapists. It can be treated. We've seen a number of patients being eventually able to, but it's something you cannot deal with it on your own. You need to see a healthcare provider.
Yeah. All right. Professor Shingai Mutambirwa, urologist and head of department at Dr. George Mukhari Academic Hospital, and Dr. Mpume Zenda, who is also known as Dr. Gynae. He's a sexologist, OBGYN. Thank you so much for making time for us.
Thanks for
always a pleasure.
Thanks
just come to work now.
Yeah, exactly. Work.
It's 3 minutes before 12.